and a little bit about the anatomy first. The part we're seeing is the intraorbital part. This is the lamina cribrosa over here. This is the optic disc head, which is visible to us in fundoscopy. This is the central retinal artery, the central retinal vein. Notice how these arteries and these veins, they are running inside the optic nerve. Inside the optic nerve. Then these are short posterior ciliary arteries, which we can see over here, right? So this was the intraorbital part. These are some visual field effects. We discuss them later, but the important thing in this figure is that some part which is in the orbit, it's the intraorbital part. This is the optic chiasm where the optic nerve ends, and anterior to it is the intracerebral part, intracranial part. So this is one important thing, that you have to know the different parts and how they can be affected. And you have the other important thing is you have to know the order of neurons. So I'll doodle a bit over here. So we know that there are photoreceptors, rods and cones. Right? They pick up the light sensation, the rays. Chemical changes take place in them. Rhodopsins, scotopsins are converted. They transmit signals. So they transmit signals to the first cells, which are the bipolar cells. These are present in the retina. And then these bipolar cells, they transmit their signals to the ganglion cells. And the axons of these ganglion cells, these different ganglion cells, they combine to make up the optic nerve. So an important MCQ question over here is, the optic nerve consists of which order of neurons? Okay, can anyone answer this question? Second order. Second order. Yes, it's second order. So why are they second order neurons? Because the photoreceptors are sensory end organs. They are receptors, they're not neurons. So this is the sensory organ, which I'll abbreviate SO. The first order neurons are the bipolar neurons, right? So the ganglion cells are the second order neurons. And where will be the third? Where will the third order neurons be present? कहाँ होंगे ये?
In the thymus?
Lateral geniculate body.
Bilkul. These are present in the lateral geniculate body. So this is an MCQ question, and कभी-कभी आ जाता होता है. I think हमें भी एक बार आया था, either a test or not. So these are ganglion cells, the axons of which combine to make up the optic nerve. They are actually second order neurons. So this was a little bit about the anatomy, relevant anatomy. बाकी हमें इतनी detail ही नहीं है. We'll study things as we go along. So when we talk about optic nerve, there are a few diseases of the optic nerve. There are a few conditions of the optic nerve, right? But being optic nerve, because it's the same entity, it's the same anatomical entity. So if it's affected, whether by inflammation, whether by passive compression, whether by something, anything, if it's affected, it will have its own symptoms, a few range of symptoms. It can have its own signs, which we can pick up on examination. And then there might be a few investigations which we should perform in order to further know or further quantify our disease, either to make a diagnosis, either to help us manage the diagnosis, or either for the treatment, we need to perform certain investigations. So what do you think if a person who has a disease of the optic nerve, or do they have a pathology affecting the optic nerve, what are the different symptoms with which he can present? The काफी diseases in optic nerves, there can be many symptoms, and all of them are different in their duration, presentation, etc. But the symptoms can be present. What do you think those symptoms are? हम एक पहले list बना लेते हैं.
Blindness.
Blindness or visual loss, right? So first we'll make a list, and then we'll see how these symptoms they differ in their characteristics in different patients. So a person is likely to suffer visual loss. That is correct. What else can a person who has a lesion or a disease affecting the visual optic nerve? What else can they have? Scotomas. आपने बोला है, if I've heard rightly. Scotomas बोला है ना?
Yes.
So yes,
Headache?
you can have a headache. चलो headache पहले आ गया. They can have scotomas. Scotomas or blind spots. Blind spots. Know how. अच्छा, कौन सा स्कोटोमा होना चाहिए? Do you think should be a positive scotoma or should it be a negative scotoma?
Positive scotoma.
So it's a positive scotoma, right? नहीं, positive है negative है, दोबारा बताओ.
पॉजिटिव होना चाहिए ना, क्योंकि वो पर्सन परसीव कर सकता है कि उससे ब्लाइंड स्पॉट्स नजर आएंगे.
ठीक है. So यानी कि there's a little bit confusion. All right. चलो, let's say you're seeing this picture, right? आप ये picture देख रहे हैं. All of you are seeing this picture right now. So let's say you're viewing this from your right eye at the moment. सिर्फ आप अपनी right आंख से देख रहे हैं. ठीक है? You're fixating on this point over here. Can you perceive your physiological blind spot? Not perceiving a physiological blind spot, even it is there. ठीक है, वहाँ पे है, it's there, but you're not perceiving it. It's a negative scotoma. ठीक है, this physiological blind spot. Now, if you had a corneal opacity and you were viewing this image with your right eye only, ठीक है, and अगर आपको इस तरह का कुछ नजर आता, ठीक है, if you're seeing, you're fixating on this point, you're viewing this with your right eye, but you're seeing something like this blackish box. Is this a positive scotoma or is this a negative scotoma? This is a positive scotoma because even though you're fixating on this point over here, you can still appreciate this. So a person who has an optic nerve lesion, they have negative scotomas. Negative scotomas because a person he cannot appreciate it as such. अगर मतलब उनको कोई धब्बा नजर नहीं आएगा अपनी आंख के सामने, कोई चीज फिक्स नजर नहीं आएगी, कोई स्पॉट नजर नहीं आएगा, कोई स्टेन नजर नहीं आएगा. ठीक है, he can pick up a scotoma, he can pick up a blind spot, but only if he is intelligent enough to know that all right, मैं कुछ चीजें देख पा रहा हूँ, कुछ नहीं देख पा रहा, I'm not immediately conscious of it. So blind spots here are their negative scotomas. अच्छा, I'm not able to open the chat for some reason, I don't know why. तो शायद खुली हो पीछे. किसी ने कुछ टाइप किया था. If anyone can read what they type, yes, I did type. So, और क्या symptoms हो सकते हैं? What else do you think can happen? Visual loss you've got. दोबारा भी बोलिएगा. I'm sorry, type किया तो मुझे बिल्कुल सुनाई नहीं रहा है. Your voice is too muffled. So I need a space for what you said. ठीक है. What else can we have?
पेन हो सकता है.
Pain हो सकता है. Yes, pain is a symptom. Pain can occur. Pain, yes, pain is correct. Pain can occur. किस तरह की pain होती है? How it's different from pain of other things? We will discuss this later on. So the fourth वो अभी type कर लेते हैं, तो हम देख लेते हैं. So do you have any of the symptoms in mind, or do you think these are all the symptoms or the common symptoms which we can have? तो let's move on to the signs. में आते थे वेलिंगटन बता दीजिएगा. But not, let's move on to the signs. What do you think we can find on different examinations? तो इसका थोड़ा सा differently चलते हैं. We know that we perform different examinations. We perform eye movements, we perform pupillary reflexes, we perform visual acuities. So I'll write things down and you tell me whether they will be normal or whether they will be abnormal. So specifically we're talking about ocular examinations at the moment. बाकी examinations हम कर लेंगे case to case, but I'm talking about ocular examinations. So the first is visual. So what can you comment about visual?
Decreased.
It will be decreased,
Reduced.
Right? Reduced or decreased, yes. So we have an anomaly in the visual acuity. So what about eye movements?
Normal.
Normal. So normal होंगी, or does anyone disagree?
Painful.
Painful. Now that's a good. Again, normal. So one thing we have is they can be painful. What? Same. I'll write this down. Same with visual acuity. So someone can comment that the visual acuity can be normal. It can be reduced. Someone can say the eye movements can be normal. They can be painful, and they can be reduced. How they are reduced? देख लेंगे. Third examination is pupillary reflex. What do you think will happen to the pupillary reflex in disease of the optic nerve?
Will be affected, reduced.
Reduced, and it can be normal. और कौन सी examinations होती हैं ना slit lamp examinations. So slit lamp examinations, we have an anterior compartment. The compartment consists of the cornea, the conjunctiva, etc. Lens, the chamber. So what do you think would typically, except for exceptional cases or other cases, the anterior compartment, what would be the examination of the anterior compartment?
It should be normal.
It should be normal, right? Because the pathology is nowhere near, the anatomy is nowhere near. So unless it's another disease causing the optic, causing a lesion of the optic nerve, a primary lesion of the optic nerve is unlikely to affect the anterior compartment because they don't share the anatomy. It's simple. We have the anterior compartment. Let's talk about the vitreous. Do you think the vitreous should be normal? Let's talk about the retina. Do you think the retina should be normal? Let's talk about the optic disc. What can you comment about these three?
Optic disc may be cupped shape.
So let we, because I'm sort of details for it. Okay, let's just say that the optic disc can be abnormal. What about the retina and what about the vitreous?
Vitreous should be normal.
Yes, the vitreous should be normal. And unless there's another pathology, the vitreous should be normal. And what about the retina? It can be abnormal, it can be. So, these are some of the things. So when you perform a slit lamp examination, when you see the anterior compartment is normal, the vitreous is normal, so you can localize your disease anatomically to either the retina or the optic disc. बाकी आपको समझ आ रही है थोड़ी बहुत. We'll go with this again. So after performing certain examinations, which investigations do you think we need to do in patients? What are the different types of investigations? Regardless, मतलब हम इनकी indications की बात नहीं कर रहे, किसमें करवाएंगे, किसमें नहीं करवाएंगे. I'm not talking about that. Just hit me with all those investigations you think we should be doing in patients in whom we suspect optic nerve pathologies. Like optic nerve में कर रहा है. Perimetry for visual fields. Perimetry or visual fields. Yes, it's an
Fundoscopy.
I think fundoscopy should be over here. Slit lamp examination है ना, fundoscopy is an examination. तो अगर हम fundoscopy कर सकते हैं, तो हम एक और examination investigation करवाते हैं in order to look at the retina. Is that investigation? FFA भी हम करवा सकते हैं, चलो OCT भी करवा सकते हैं. और आपको क्या लगता है कोई एग्जामिनेशन हमें करवानी, ऑक्यूलर इन्वेस्टिगेशन सॉरी करवानी चाहिए? और do you think that these are the common ocular investigations and all right? You can proceed with our case for today. B scans. B scans की indication क्या है? I want you to tell me at least 2 indications of a B scan.
अगर हम डायरेक्टली नहीं देख सकते ऑप्थेल्मोस्कोप से,
बिल्कुल नहीं देख सकते,
कोई
right?
ट्यूमर है या
बिल्कुल. So exactly. So if there's an optic nerve lesion, it's unlikely that it's causing something in the vitreous or something so pronounced that we cannot perform a. अगर opacity आ जाती है, तो that opacity is our main concern. It's our main diagnosis, and it will be the first thing which we aim to treat. So it's unlikely that we will need to perform a B scan in a patient who has an optic neuritis or a papilledema. Okay, it has certain indications. A CT scan. Why do you think we should perform a CT scan?
Nerve का कोई gross damage हो तो
बिल्कुल. So if there's a mass lesion, if there's a space occupying lesion, we can pick up it on a CT scan or an MRI or in simple terms, brain scan. So I think these investigations are enough for you at the moment. इतनी काफी है. So these symptoms, they will become clearer to you कि visual loss कितना होता है, किसमें होता है, headache क्या है, कितना होगा, scotomas क्या हैं, कौन क्या होंगे. All of these things will become clearer. So I only have 2 cases for the day. They're 2 important topics, the commonly tested ones. So let's start with 40-year-old female presents you with cloudiness of the right eye. I think this is a good start. We'll do this case first. अच्छा, read this case. इसमें जो important presenting complaints आपको लग रही हैं, ठीक है? Keep them in mind. And imagine yourself as the practitioner to whom this woman is reporting, and how will be perceived. So let's take a look at this patient. She's a woman. She's 21 years old, and she presents to her general practitioner. मतलब आप हो सकते हैं, ठीक है? 1 month history of severe headaches. Yeah, this is our first presenting complaint. Severe headaches. कितनी duration है? 1 month. On further inquiry, she reported intermittent episodes of blurred vision. Intermittent episodes of blurred vision. The second important. So she was overweight and had a body mass index BMI of 60. So this can either be present obesity, and so this can either be a comorbid or a premorbid. So we have one more thing. So if I just tell you this, काफी ज़्यादा आपकी चीज़ों में सेम चीज़ आनी चाहिए. 1 month history of severe headaches. Severe headaches, migraine में हो सकते हैं, cluster headaches, tension headaches, all these different types of headaches. And she has headaches along with episodes of blurred vision. ये तो acute angle glaucoma भी हो सकता है. So you're having different thoughts in your mind. When you're comparing these symptoms for all the diseases you've studied in ophthalmology, right? So let's say we have to work up this patient. How will you work up this patient? क्या करना चाहेंगे आप? What is the first thing which you should do?
Visual acuity.
ब्लड प्रेशर मेजर करें.
Blood pressure measure करना चाहेंगे, visual acuity measure करना चाहेंगे. So first thing is, all right, you have some क्या कहते हैं, general examinations as well, which are part of GPE, and then you have some ocular. So GPE is very important. It tells you a lot of things. So in GPE, you said you'd like to measure the blood pressure of this patient. I'll ask you why. For now, her blood pressure is normal. It's 120 by 80 millimeters of mercury. Pulse 80. Respiratory rate is कितना होता है respiratory? It's around 15.
16 to 20.
15 just 15 per minute. And then we have fever. She's afebrile. So you have a good general examination. अब आपको an examination पे देख के पता लग रहा है, you know a few things. Ask the reason why we're measuring this blood pressure specifically. थोड़ी देर बाद मैं बताऊंगा, पूछूंगा. Write a question mark over here. But looking from this patient, we can see from the general physical examination that she is under no visible distress. Cardiovascular, she's hemodynamically stable. She has no tachypnea, no dyspnea, and she has no signs. This is a sign of inflammation. Inflammation में होता है, and mostly inflammation caused by infection. तो हमें काफी कुछ पता लगता है. On ocular examination,
Blood sugar levels करें. Blood sugar levels.
Blood sugar levels आप करा सकते हैं, but in a patient case of diabetes, she is obese. Now that is correct.
She's overweight and has high BMI. Maybe she's a patient of type 2 diabetes.
बिल्कुल. But do you think type 1 is common in this age group or type 2?
So obesity. वैसे तो
Type 1?
young है तो type 1 ही होगी, लेकिन type 2 भी develop हो जाती है.
Type 2 भी develop हो सकती है. बिल्कुल. So बिल्कुल, she is obese, diabetes. So yes, you're correct. हम आगे चलो GP perform ocular examination से पहले we perform a blood sugar examination. हमें थोड़ा बहुत idea हो जाए. So you perform a blood sugar random because it hasn't been diagnosed and आपके पास presentation है, she is not fasting, so it's a blood sugar random. A blood sugar random comes out to be 160. Normal or abnormal? Normal है ना? So it's normal. एक चीज आंखों की. Any other extraocular examination you would like to do? या हम आई की तरफ आते हैं. Now these two examinations are very important. They might look simple to you, but they're very important. So visual acuity, when we perform a visual acuity, it's 6 by 18 OD, right eye, and it's 6 by 12 OS, left eye. और आप आगे कहना चाहेंगे, you know that visual acuity is normal, subnormal, it's abnormal. Which other investigations would you like to proceed with?
गोनियोस्कोपी करेंगे.
Gonioscopy, you're thinking that her angle is closed. That is why she is having all these different symptoms, intermittent episodes of blurred vision and severe headaches. So you're thinking her angle is closed. But on gonioscopy, you find her angle is open. First thing, her angle is open. हो सकता है she is a subacute angle closure suspect. She has subacute glaucoma. She's an angle closure suspect. So you grade the angle, but you know that the angle is open and it's adequate. And there are no signs of previous angle closure. आपने कि glaucoma book से पढ़ा होगा तो you know that there are some signs जो indicate करते हैं कि पहले angle close हो चुका है. वहाँ पे iris की atrophy होती है, थोड़ी corneal staining हो जाती है. These are different signs which are not high yield for us, but in context of this case, there are no signs indicating previous closure.
भाई गोनियोस्कोपी से पहले टोनोमेट्री नहीं करनी चाहिए.
आपको बिल्कुल टोनोमेट्री भी करनी चाहिए. तो आई एम हेयर, आप जो कहेंगे मैं वो करवाऊंगा. सो व्हेन यू परफॉर्म ए टोनोमेट्री, आईओपी, इट्स नॉर्मल इन बोथ आइज. नॉर्मल कितना है? 15 mm, 15 और डी में कह लेते हैं, चलें. एंड इट्स नॉर्मल इन बोथ आइज.
भाई
अब आपने
हमारे पास यंग फीमेल पेशेंट है तो हम ऑटो इम्यून प्रोफाइल भी करा सकते हैं.
बिल्कुल करा सकते हैं, बिल्कुल करा सकते हैं. नाउ ऑटो इम्यून, बिल्कुल you're right. But the thing is, there are two things which I want to clarify. An autoimmune profile is an investigation. It's not an examination. And you'll only do investigations if you find that there are symptoms and signs pointing towards an autoimmune disease, right? Now, the demographic is consistent with patients who have autoimmune diseases. But do you think we have signs, हमें बाकी signs मिल रहे हैं autoimmune diseases के? Or if is autoimmune the likely clinical diagnosis, हमें कोई और diagnosis तो नहीं मिल रहा? We cannot know for sure until we have performed our complete examinations. आप कहते हैं अच्छा ये मसला आपको autoimmune की वजह से हो सकते हैं. Even आपने भी पूरी examination ही नहीं की. So what is your indication for ordering an autoimmune profile? Do you think she has a malar rash? She has SLE? Do you think she has rheumatoid arthritis? Do you think she has systemic sclerosis? These are autoimmune diseases, right? They have their indications, findings on examination. Unless we find them, we don't need to do. और अगर हमें बिल्कुल शक है, we have to exclude other in examination of clinical findings, other clinical diagnosis first. तो आपने अच्छी बात की ऑटोइम्यून कॉजेज. वी विल डिस्कस दिस. करवा लेते हैं आपके कहने पे आगे जाके. तो जिस तरह अभी मुझे किसी ने कहा था कि वी नीड टू टोनोमेट्री हमें पहले कर देनी चाहिए, तो आप में से कोई और भी ये भी कह दे कि हमें आई एग्जामिनेशन भी करवा लेनी चाहिए, आई मूवमेंट्स करवा लेनी चाहिए, हमें पिपिलरी रिफ्लेक्स करवा लेना चाहिए. So do you think we should do those or we shouldn't? We should. तो फंडोस्कोपी भी करनी चाहिए, बिल्कुल. तो चलो हम पहले पिपिलरी रिफ्लेक्सेस करवा लेते हैं. पिपिलरी रिफ्लेक्सेस, they are normal. Next thing, आई मूवमेंट्स. थोड़ी सी मेंटल एक्सरसाइज होगी, थोड़ा सा लंबा हो सकता है. Focus on this. I hope you learn great things. So when you perform eye movements of this patient, this is what you see. Which nerve palsy is this, and on which side?
Left.
Left
Left, which
sixth nerve.
left, fifth, sixth nerve palsy, which is affecting which muscle?
Lateral rectus.
The lateral rectus. So you have left CNVI, cranial 6 palsy, or in simpler terms, the left LR is affected. So you performed an extraocular movement examination. So these are your findings on extraocular. So I think it's time for a frontoscopy or a slit lamp examination. हम generally बात कर लेते हैं. So a slit lamp में मैं आपको पहले बता देता हूँ anterior compartment. It's unremarkable. You do not find anything in both eyes. UN कहते हैं something like unremarkable both eyes. Let me show you.
भाई 6 nerve palsy कैसे जरा explain करना please.
मैं कर देता हूँ, no problem. And so, all right. In this figure A, which is labeled A, we can see that the patient has been commanded to look towards his right side without moving his head. Both his eyes are towards the right, and we can see that they're moving equally. Okay, there's no problem. In the middle figure, labeled B, patient is looking straight forward, straight ahead. There's no issue with the eyelids, as we can see. मतलब process नहीं है, इतना हमें नजर आ रहा है, at least. In the third examination, when the patient is ordered to look towards the left, she can look towards the left with her right eye, but she cannot look towards the left with her left eye. So इस तरफ जब देखना होगा, तो her right eye will use her medial rectus and her left eye will use her lateral rectus. So her left lateral rectus is not functioning. That is, and we know that the left lateral rectus is applied by cranial nerve 6, so it's left lateral rectus abnormality lesion. So when you perform a frontoscopic examination, you find something abnormal in both her eyes. So let's focus on the right eye first. This is the right eye. This is the macular area. This is the nasal part. This is the temporal part. Look at this optic disc. Look at this optic disc. Can you appreciate?
margin.
Yes, you cannot appreciate the optic disc margins. आपको nasal side पे थोड़े नजर आ रहे हैं, but they are blurred on the temporal side. What are these? What are these?
Hemorrhage.
Hemorrhages.
ठीक है? These are flame-shaped or streak hemorrhages near the disc. What are these white spots?
Cotton wool spot.
Cotton wool spots. ठीक है? Soft exudates. And what can you tell me about the vessels? थोड़ा vessels पे गौर करते हैं. All right. Let's look at this vessel. ठीक है? Look at this
Tortuous vessel.
I think it's tortuous and engorged, it's enlarged. और उसके मुकाबले में, we know that arteries and veins, they tend to run together. So this is a vein, this is an artery. The arteries are somewhat smaller. Veins are tortuous, they're enlarged. The arteries are somewhat thinner. Also here, also look at this vein, look at this artery. Look at this vein, look at this. So we find out that the disc margins are blurred. The first thing. The second thing, there are some hemorrhages. The third thing, there are some soft exudates, cotton wool spots. The fourth thing, dilated and tortuous veins, plus somewhat diminished or attenuated vessels. Okay. Look on the left side. Peripheral changes को हम थोड़ी देर के लिए छोड़ देते हैं because अभी रेटिना हम डिस्कस नहीं कर रहे, बाकी और थोड़ी confusion हो जाएगी for people who don't know. Can I say that the changes present in the right eye, they are also present in the left eye?
Yes.
Okay. So whatever this is, it's affecting the eyes bilaterally. So on fundoscopic examination, there is bilateral disc edema / blurring of disc margin. There is bilateral disc edema, blurring of disc margin. There are bilateral soft exudates. There are bilateral hemorrhages. There are bilateral dilated. Okay. So after this examination, you probably should have a few differentials in your mind, especially for those people who have studied retina. No problem. So we have our fundoscopic or slit lamp examination findings. What other examination would you like to perform?
Light reflex.
Light reflex, we've performed a light reflex. Light reflex आपको पता है कि pupil effect होता है light reflex पे. But it's normal. Meaning that कि आप आंख आगे shine करते हैं. The video I've showed you, अगर आपने वो देखी है, तो it's not a relative apparent pupillary defect. It is not present. So, a few questions up till here. Okay, I think we've done all the necessary examinations जो हमें जरूरत पड़ जाती है. We've done all of these. What differentials come into your mind, and on the basis of these examinations, which investigations would you like to perform in this patient? These are my two questions to you.
Papilledema.
Edema or papilledema.
So let's write our differentials down. Which differentials do you think? The first, someone has said that it can be a papilledema. Optic neuritis, right? So you have optic neuritis. और क्या हो सकता है?
Optic neuropathy.
Optic neuropathy. Optic neuropathy. You have a list of differentials. You have papilledema, optic neuritis, optic neuropathy. और आप क्या सोच सकते हैं?
Optic disc edema.
Optic disc edema. Optic disc edema is a finding which can be due to different things, right? तो वो एक finding है जिसको हम कहते हैं soft spots हैं, hard exudates हैं, they can be due to different. So it's a sign. Central retinal vein occlusion. चलो मैं लिख लेता हूँ CRVO. लेकिन मैं बड़ा सारा question marks. Any other differentials do you think? Chalo. Retinopathy.
Atherosclerotic lesion of the retinal artery.
Can you repeat that, please? I didn't get you.
Atherosclerotic lesion of the retinal artery.
Atherosclerotic lesion of the retinal artery. Atherosclerotic lesions of the retinal artery. So if it's an artery, you're thinking it can be a CRAO, right? I write a few things down. Actually, there's one examination we forgot. We forgot to perform a perimetry. It's important. So when you perform a perimetry of this patient, I have a few things. You perform a perimetry of this patient, right? So what is abnormal in this perimetry?
Enlarged blind spot.
ठीक है, ट्यूमर क्या होता है? What's a tumor? What's a tumor? आपके ज़हन में क्या है? How can you reach tumor? मैंने गलती से दिखा दिया कि people have reached the diagnosis. अच्छा, there's an enlarged blind spot, especially on the left side. You can see that this decreased sensitivity reaches the peripheral areas. Similarly, right side भी थोड़ा सा बढ़ा हुआ है. Anything else which is abnormal?
कुछ peripheral side scotoma.
Peripheral side पे आ रहे हैं, right? So you can see that जो black है उसका मतलब है उधर इतना कम vision है. normal, you remember that normal बिल्कुल इस तरह होना चाहिए था, तो थोड़ा सा कम है centigrade, and at the peripheries it's even denser, and some of the black spots. So there's a generalized depression, and there are some scotomas present in the upper temporal quadrant in both eyes. So on perimetry, there are two things you find. First is a large blind spot, and then the other thing which you find are generalized depression. Okay, तो perimetry आपकी investigation एक हो गई. Which other investigation would you like to perform?
Rule out the problem of brain.
Brain. So if you want to rule out a brain problem, which examination would you perform?
FFA.
CT scan. Acha, FFA. What does an FFA tell us?
Retinal vessels grow.
Hi, what does FFA stand for?
It's fundus fluorescein angiography. It's an examination of the retina, investigation of the retina, in which we check out the leakiness of the vessels. So FFA in this case is likely to show, it's likely to show leaky vessels at the disc. In simple terms, क्योंकि हमसे नहीं कहते read करना, it's above our level, but it's abnormal. What I'm trying to say is FFA is abnormal. Okay, those leaky vessels around the disc. Someone said that we need to rule out something else. What was that something else? We need to perform a CT scan or an MRI of the brain. So when we perform a CT scan or an MRI of the brain, this is what we see. This is a brain image, this is an MRI scan. Other details में नहीं जाएंगे, but you can see that there's something present over here. Different sections of brain care. So what you're seeing is a space occupying lesion on the CT scan or the MRI. All right, your forms from the examination. काफी कुछ बन गया. So you had a list of different differentials at the start. I have 1 minute remaining.
इसके लिए further intracranial pressure करते हैं, intracranial pressure देखेंगे फिर measure करेंगे किसी तरह से.
Intracranial pressure कैसे measure करते हैं? How intracranial pressure is measured? Lumbar puncture. So do you think we should perform a lumbar puncture on this patient?
No, you should not. लेकिन
पहले हम imaging करेंगे उसके बाद lumbar puncture करेंगे.
Then cool. So we usually perform imaging first and lumbar puncture second. So if the imaging is clear, we perform a lumbar puncture. But if we can find a space occupying lesion on the lumbar imaging, we do not perform a lumbar puncture, because what can happen, lumbar puncture in sitting position में usually जब करवाते हैं, so we can likely guess that this is causing a pressure effect. So if massive CSF it escapes during the lumbar puncture, we can have a herniation of the brainstem from the foramen magnum into the spinal cord, and that can cause sudden death. So it's not advised to perform a lumbar puncture in a patient who has such findings. Such findings covered I'm using because there are some findings over here. So I think we've done all the investigations. I'm ending the session now. Take a look.